From lungs to pelvis, inflammation in the urinary tract and pelvic area. Welcome back to the Stop the Inflammation Pandemic series. This is Anjela, Holistic Medical Herbalist. In our last video, we took a deep breath literally and explored how inflammation affects our respiratory system. We looked at how everyday irritants like dust or pollen can trigger sneezing, congestion, and mucus production. These are normal immune reaction until they don't stop. That's when inflammation becomes chronic, especially when the mucosal lining, the body's protective barrier, is dry or damaged. We talked about how something as simple as a sneeze can evolve into a chronic sinusitis or bronchitis, and how immune system starts misfiring, attacking even harmless things. We also saw how acute inflammation helps us heal, but when the immune system can't shut off, like in long COVID, we end up with damage to the smooth muscle lining, not just in the lungs, but in other organs too. The message was clear. It's not just the virus or allergen that's the problem. It's how the immune system responds. And the solution, not immune suppression, but immune modulation. Through an elimination diet, antioxidant-rich foods, and targeted herbal support like Marshmallow Root Plus, Elderflower Complex, and Lungwort Plus. Now, in this next part of our journey, we are moving downwards from lungs to the pelvic region, where inflammation in the urinary tract, bladder, and the surrounding tissues can cause chronic discomfort. It's a topic that is often overlooked, yet it deeply affects the quality of life for so many. We are going to zoom in on the bladder and the urethral lining and explore how inflammation in these smooth muscle tissues can lead to persistent and confusing symptoms. To help make it real, we'll walk through some case scenarios. Let's start with Mrs. X. She's suffering from frequent urinary tract infection, needing antibiotics every 4 to 6 weeks. The antibiotic itself offers relief, but only for a short while. Soon the symptoms return, burning while urinating, needing to urinate constantly in tiny amounts, and that feeling of heat when passing urine. So what's really going on here? Is it just a bacterial infection? It may have started with a bacterial infection, but over time her immune system became overstimulated, creating chronic inflammation. Now the real problem isn't just infection, it's inflammation in the smooth muscle lining of the urinary tract. That's what we call interstitial cystitis. It's often misdiagnosed or misunderstood. Unlike a typical UTI caused by bacteria, interstitial cystitis is a chronic inflammatory condition that affects the inner lining of the bladder. There may be no clear infection at all. The protective lining breaks down, allowing urine to irritate the bladder wall, causing pain, urgency, and discomfort. People often keep getting treated with antibiotics but never truly recover because the real issue, the inflammation, is never addressed. So what's the right approach? We need to heal the lining and strengthen the tissues so that friendly bacteria can colonize and restore balance. Now, let's look at Mr. X's friend, a 67-year-old man. He is experiencing urinary leakage and can't hold urine long during the day, though he is fine at night. Sometimes it leaks without him noticing, and the flow is weak and slow. His urologist examined him, did a prostate exam, and confirmed only slight enlargement with normal blood work. But the symptoms are real and they are impacting his quality of life. So what's the cause? This is another case of inflammation, this time in the urethral and bladder lining. How do we know? In men, the urethra is longer, so the inflammation can obstruct flow. If the tissue is inflamed, the bladder can't empty fully, leading to leakage. The fact that he is fine at night also suggests the prostate isn't the main issue, since it's not pressing on the bladder during sleep. So, what do we do? As always, our approach is to reduce inflammation and to restore healthy tissue. Here are the herbal formulations I recommend. Marshmallow Root Plus, a foundational remedy for healing any smooth muscle lining, whether it's in the bladder, colon, or lungs. Corn Silk Plus, ideal for men with bladder or prostate related inflammation. It strengthens the bladder wall and contains mild diuretics to improve urine flow. For Mrs. X, along with Marshmallow Root Plus, I recommend Couch Grass Complex. It strengthens the bladder lining and includes antiseptic and antimicrobial herbs to gently reduce pathogens while supporting tissue repair. Like all herbal approaches, these formulations work gradually. I recommend at least 3 months of consistent use to begin seeing lasting change. And of course, if you're taking medications and managing other health conditions, always consult a qualified holistic practitioner to avoid interactions and tailor your treatment safely. We will talk more about inflammation in the reproductive organs in both men and women in an upcoming video. But in our next episode, we are heading even deeper, exploring how chronic inflammation affects the lymphatic system and its smooth muscle lining. Until then, thank you for being here, and remember, healing begins with awareness. So take a moment today to really listen to your body.